Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order and this is quite convenient for the study purpose. My dear friends, we have been discussing about newborn care. In the first three classes, we have described the newborn care as for the contemporary medical science as practiced nowadays in the delivery room during the delivery and after the delivery. Today we will get into a new subject, that is newborn care and its concept in Ayurveda. Now Ayurveda explains a very good sequence of newborn care and which is even applicable today. But we need to understand this concept in a little scientific way by exploring some of the critical analysis, and we shall do that one by one. Now, newborn care has been explained in detail or dealt in detail in Ayurveda. Now we have got three important samhitas like Charak Samhita, Shushu Samhita and Vagvata, that is Ashtanga Sangraha and Hridaya. So all the three main samhitakaras dealt regarding newborn care in detail. But if you look into the sequence, there is some change in the sequence. For example, Charaka's explanation regarding newborn care says that Prana Pratyagamana should be done first, that is breathing, initiation of the breathing. This will be followed by Snana, this will be followed by Mukha Vishodhana, and this will be followed by Garbhodaka Vamana. Garbhodaka Vamana is nothing but presented as stomach wash. Mukha Vishodhana is nothing but cleaning of the oral and nasal cavity. So this is the sequence given by Charaka. But when you go to Sushruta's reference, he says that first we have to go for Mukha Vishodhana, that is cleaning the oral cavity and the nasal cavity. This will be followed by Pichu Dharana, that is application of the gauze piece dipped with the oil over the forehead area. This will be followed by Nala Chedana, cutting of the umbilical cord. And this will be followed by Jata Karma. So like this, Mukha Vishodhana, Pichu Dharana, Nala Chedana and Jata Karmas. Okay, so this is a sequence given by Sushruta. Now Ashtanga Hridaya or Vagbhata says, first you have to go for Ulbha Parimarjana. This will be followed by Prana Pratyagamana. This will be followed by Nala Chedana or cutting of the umbilical cord. And lastly we have to go for Snana. So if you look into the sequence and compare the same sequence with the present day newborn care, it matches unlikely. Okay, especially Charaka's, Sushruta's explanation, it looks that it has got no logic at all, because he is indicating Snana in the second step immediately after Prana Pratyagamana. He is going for Mukha Vishodhana later. Okay, so like this, some of the irregular sequence is there. But it is not like that. We need to understand this properly. Now, after observing the above methods of newborn care given by the different authors, that is steps in the newborn care, so we can actually divide these sequences into two groups. When he says these different steps, he is not specifying whether it is a sick baby or whether it is a normal baby or good looking baby. Okay, so normal or sick baby or non-sick baby, it is not clear. In general, they have given these steps. Now, we in the present scenario, we have to divide this into two important steps. So, one is we have to divide it into care of the normal baby and care of the sick baby. Care of the normal baby and care of the sick baby. Now, when we come to the care of the normal baby, Garbhodaka Vamana, we can see the steps like Prana Pratyagamana and Garbhodaka Vamana are actually meant for the sick babies who fail to initiate the spontaneous breathing after the birth. Okay, and rest of all the procedures which is explained by all three authors, okay, it is included under the routine care of the baby. In an order, they can summarize as given below. Now, first we have to take all these steps and divide into two ways. One is care of the sick baby, another one is care of the normal baby. Care of the sick baby, only two procedures are mentioned here. One is Prana Pratyagamana and another one is Garbhodaka Vamana and other things. Whereas rest of all the procedures are actually meant for care of the normal newborn baby. Now, after observing the above steps, the newborn care is divided into two ways. Now, newborn care in Ayurveda, if you see, cleaning the oral as well as the nasal cavity and as well as the body. Oral cavity, nasal cavity, and as well as a body. Now, rest of the procedures are included under the routine care of the baby, we know that. Now, we have to put these steps in an order. First one, you take cleaning the oral cavity, that is Ulba Parimarjana. That is cleaning the oral cavity and nasal cavity. It is also mentioned as Mukha Parimarjana or Ulba Parimarjana, and Sushruta mentioned the same procedure as a Mukha Vishodhana. Sushruta mentioned it as Mukha Vishodhana, and Ashtanga mentioned it as a Ulba Parimarjana. It is cleaning the oral cavity and nasal cavity from the amniotic fluid, including the body. Okay, so definitely this will be the first step in any of the newborn care when you receive the baby. Okay, so cleaning the oral and as well as the nasal cavity and as well as body is mentioned. Then second step will be cutting of the umbilical cord with a cord care. Okay, although here it is mentioned in an irregular fashion, now we need to arrange it in a proper way. The first step will be cleaning the oral cavity and as well as the nasal cavity and the body, which is mentioned as Mukha Vishodhana and also mentioned as Ulba Parimarjana. Second step will be always cutting of the umbilical cord with the cord care and as well as umbilical cords. So this has been mentioned by Snala Chedana. Okay. Third one is important step is the protection of the anterior frontal. Anterior frontal is considered as one of the weakest area of the skull, which may be always vulnerable for the injury, and it has to be taken care both for therapeutic purpose and as well as a preventive purpose. And again, protection of the AF and also maintenance of the temperature, because as the temperature loss will be maximum from the forehead and head area, it has to be covered normally in the beginning itself by insulating substance like Thaila. So this will be followed by bathing. Or which is mentioned as Snana. And this will be followed by initiation of the immune response and trophic feed, which is mentioned as a Prashana or Jata Karma. Okay, it is mentioned as Jata Karma, initiation of the immune response and as well as trophic feed. And other protective measures and aseptic measures which has to be followed in the normal newborn care has been mentioned as a Raksha Karma. Okay, it has been mentioned as Raksha Karma, Swarna Prashana, etc. Okay, so if you take all these steps in an order, now we can arrange this in the following way. Now let us have the comments. Why this zigzag presentation is there? Why there are so much confusion is there? Okay, so let us see one by one. Different steps of the newborn care has been explained by different authors, which is quite obvious as they have lived in the different centuries. Now Charaka's explanation, Sushruta's explanation and Vagbhata's explanation differ a lot. Okay, because it is very clear that so they have lived in the different eras, different centuries. So definitely as the time passes, there is improvement in the newborn care and accordingly they have mentioned. Number one. Number two is Charaka, which is mentioned by Charaka, it is not clear that whether he is mentioning it for the sick baby or non-sick baby. It may be for the sick baby. If for the sick baby, Prana Pratyagamana has to be done in the beginning. Okay, and Snana may be done later. So like that. So although the steps are same, the orders are completely different. Probably each author is facing a different clinical situation or a different practical situation, like term baby, post-term baby or preterm baby. We are not quite sure about that. Charaka may be dealing with a sick baby, Sushruta may be dealing with a preterm baby, or Vagbhata's explanation may be best suitable for a term baby. We don't know that because that explanation is not available. Change in the order shows that the trial and error method adopted by the acharyas. Now Charaka's steps are different, Sushruta's steps are different, Vagbhata's steps are different. So as the century passes, so they have learned so many things and they have done so many trial and error methods, and at the end the Vagbhata has given most acceptable steps. Now in this total 3 columns, if you see, the Vagbhata steps looks be more practical in the present day scenario. So this may be because they have learned from the trial and error methods, and the Vagbhata is the latest author among the 3, and he has produced or provided a more suitable, clinically applicable sequence. So this being the case, now we will see the Nabhi Nala Chetana, which is very, very important. So that we will see in the next class.